It's been 1 week since the Supreme Court's conservative majority struck down Roe versus Wade, changing the landscape of abortion access across much of the nation. As many Americans are still making sense of the impact of the ruling, ABC's Rachel Scott has been traveling throughout the country all week, getting a sense of what's happening on the ground in states restricting abortion and those fighting to expand access. Here's her report.
Tonight, uncertainty and emotion in a post-Roe America. We hit the road from the deep south to the heartland. The Supreme Court's ruling 1 week ago exposing deep societal rifts and splitting the country in half.
I honestly cried tears of joy.
The Supreme Court turned their backs on women in general.
Roughly a dozen states have stopped nearly all abortions. 13 others will likely restrict access in the coming weeks and months. Those so-called trigger laws were on the books in some cases since before the Civil War, fueling a new round of legal challenges.
I don't think that a law that was written before the Civil War or before women secured the right to vote should be used to dictate these intimate decisions on reproductive health.
Regional Logistics Center. In Fairview Heights, Illinois, where abortion is legal, the phones keep ringing. The staff here are helping out-of-state patients secure transportation and hotels.
And when is your appointment?
Outside of our normal service area, Tennessee, Texas, Oklahoma, Arkansas, Mississippi, we are seeing those folks already coming to us.
Are you bracing to see a surge in patients?
Yeah, we said this is ground zero and we're bracing for impact for sure. Projections indicate that Illinois as a state might see up to 30,000 additional abortion patient seekers, and about half of those will come here to Southern Illinois. So we're looking at more than 100% increase in the volume.
An increase in volume that has this clinic counting on additional support from state lawmakers. Illinois is quickly becoming a safe haven, surrounded by states banning or severely restricting access to abortion.
We are very fortunate that we have an administration here in Illinois that is incredibly supportive. We've been working with the governor to shore up some funding, for example, for the clinics who are here on the ground looking to absorb those patients.
Just 15 miles away in Missouri, where abortion is banned, Republican State Representative Mary Elizabeth Coleman is working on legislation that could prevent healthcare workers from helping patients get abortions in other states.
What I would like to see happen is people's activity in the state of Missouri follow the law in the state of Missouri. And if people are going to choose not to do that and to violate the laws of our state, then they will be liable under the penalties in our code for that activity.
But a provider making a call to schedule an appointment for a woman seeking an abortion already in Missouri, in your opinion, that should be something that should actually be looked at?
Yeah, for activity that is in the state of Missouri, then it's something that we'll definitely take a look at in the future.
She says she's been waiting her entire life for Roe to be struck down.
When I was a little girl, I was said, I'm part of the pro-life generation, and we would say, we're the generation that's going to end Roe. I didn't expect that we would see it, maybe even in my lifetime.
Back in Illinois and closer to the Indiana border, which is expected to restrict access to abortion, this clinic describing the typical patient they are seeing.
It's really patients who are already facing immense barriers to health care. Patients who have already been marginalized by the healthcare system, patients who are struggling to make ends meet, who are deciding, do I pay my rent or do I feed my kids? And it's really heartbreaking how disproportionate it is.
Medical staff in states where abortion restrictions are closing in, now focusing on reproductive health care education.
We've been here ever since the wheels started turning.
In Mississippi, the nation's poorest state, Juliette Thomas and Antoinette Road often drive hundreds of miles to provide underserved communities with free reproductive and sexual health care services, all from their mobile clinic.
Being from the Mississippi Delta, you know, a lot of clinics have closed due to lack of funding and other things.
They have found most women in the area do not have easy access to reproductive health care, let alone contraception and other family planning services.
Having access to quality health care, people of color don't have, and even being educated on what questions to ask when they go to their provider, you know, that's kind of not done in the African American communities.
This clinic does not provide abortions, but takes a hand-on approach and helping patients prevent unwanted pregnancies before they happen through emergency contraception like Plan B.
A lot of communities, the clinics are not trained to do family planning or anything like that. so therefore they don't have those services. Yes, they may come in for a plan B, but we counsel them on how to use that.
Roe was overturned yesterday. This is illegal.
Studies show states with the most restrictive abortion laws have invested the least in policies and programs for women and children.
Making the laws has to be just part of the solution. Having a culture that supports women has to be the priority as well. I would say that what I'm trying to do is make sure that we have women have access to all the resources that she needs once she has found out that she's facing a pregnancy.
Several states now looking into legislation that would stop women seeking an abortion from crossing state lines. The Department of Justice vowing to fight any movement restrictions in a statement released last week, saying women who reside in states that have banned access to comprehensive reproductive care must remain free to seek that care in states where it is legal.
There is no magic bullet, but if there is something we can do, we will find it and we will do it.
Internet searches for abortion pills up nearly 162% in recent months, and the Roe ruling may set the stage for future legal battles over abortion medication. All this while President Biden is calling on Congress to change the Senate rules, allowing an exception to the Senate filibuster to codify abortion rights.
We have to codify Roe v. Wade in the law, and the way to do that is to make sure the Congress votes to do that. And if the filibuster gets in the way, it's like voting rights. It should be, we provide an exception for this.
Millions of women and the healthcare staff that support them now face an uncertain future.
It still felt soul-crushing to know that this country that is supposed to be leading the free world has just allowed at least half of the people in our country to lose access to such basic reproductive health care. Disappointing, devastating, and quite frankly, embarrassing for this country.
Our thanks to Rachel.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.